Pritchett, and I want to talk to you today about methamphetamine use and its impact on the user, the family, and the community. Statistics, according to the Substance Abuse and Mental Health Services Administration in 2004, an estimated 12 million persons 12 and over use meth. The numbers continue to rise. The cost of meth in the United States economy in 2005 was $23.4 billion. A little bit of history. It was first synthesized in 1887, and in 1919 it was turned into methamphetamine by a pharmacologist in Japan. In the 30s, doctors used it to treat asthma and narcolepsy in the United States. In the 40s, and this is very interesting, it was marketed to soldiers in United States, Japan, but especially in Hitler's army in Germany. It was used to fight fatigue and enhance performance. One added benefit that it makes its users devoid of any conscience. Hitler was quoted saying, "Amphetamines are power drugs that reduce fatigue, heighten aggression, and diminish human warmth and empathy." In the 50s, there was an epidemic in Japan, and that's when it began to spread to the United States. In the 60s in San Francisco, it was injected by doctors to treat heroin addiction. In the 90s, it started coming in from Mexico into the West in a smokable form that was very cheap. In 2000, in the West and Midwest, it was the favored hard drug. And now it has gone mainstream all over the country. Some of the headlines, just to show you how mainstream it is: Brett Favre's sister was arrested in a meth bust. Michael Douglas's son was arrested in a meth bust, and $44 million meth bust in Metro Atlanta Walmart. As a practitioner, healthcare practitioner, we need to know that meth is a powerful central nervous system stimulant. It releases a surge of dopamine that produces an intense rush and feeling of pleasure that begins within 3 to 5 minutes. It produces an increased energy, focus, confidence, sexual prowess, and an increased feeling of desirability that lasts up to 12 hours. Over time, meth destroys these dopamine receptors, making it more and more difficult to feel pleasure, which causes a user to use more and more of the drug. An example of how powerful it is: sex increases dopamine levels 100 to 200 units, cocaine 350 units, meth 1,250 units. That's 12 times that of sex or your favorite food. It causes destruction of tissue and blood vessels by intense vasoconstriction and shunning of blood. The user develops acne and sores that won't heal. His skin loses its luster and elasticity. They exhibit tooth grinding, dental decay, what they call meth mouth. They have muscle cramps from electrolyte imbalances. They begin to look gaunt and frail. They're often referred to as the walking dead. Meth heightens libido and impairs judgment, leading to risky sexual behaviors. And this increases your risk for sexually transmitted diseases. Over time, this may destroy sexual desire, performance, and impotence. It increases your heart rate, body temperature, causes liver damage, kidney damage, convulsive, stroke, MIs, anything that a vasoconstrictive state would do to your body. Typically, the meth user will have days of binging, where he uses the drug repeatedly for days, staying up, not eating, not sleeping. Then they, a lot of times, will become psychotic, where they hallucinate or they're confused. And then they have this crash phase where they're very lethargic. They can't wake up. They may sleep for 2-3 days, only getting up just to eat and going right back to bed. They're unresponsive at times. They exhibit psychotic behavior. They get very depressed, suicidal, have feelings of hopelessness. There's no typical meth user. Every socioeconomic background is involved. The majority of users are white people ages 18 to 24. Studies have shown that users can regain most of their function if they stop using the drug. After 14 months of being clean, users had regrown most of the dopamine receptors, but not 100%. The best they could usually hope for is 90%. If they have impairment of their cognitive or memory, any ability like that, that is usually has no improvement whatsoever in their memory, judgment, or motor coordination. Some report never feeling happy again. The saddest casualty of meth use is children. Some of the headlines I read was 2 toddlers left starving in a tent in the woods in Gainesville, Florida, while the parents binge on meth. Another one was in Dalton, Georgia, where just a couple of weeks ago, where a woman and her mother and boyfriend were in a car. The police pulled them over. The pregnant woman, who was 19, decided that she was going to hide the meth in her body. She did, and within hours it burst, and it killed her baby, and she died 2 days later from a massive MI. The National Center on Addiction and Substance Abuse estimate that 25% of U.S. children live in a household with a heavy drinker, and 13% live in a household where adults use illicit drugs. In Georgia alone, that translates into 1 million children. In 2010, 62,000 dependent children had a parent in prison in Georgia. 2/3 of Georgia inmates with addiction problems also have dependent children. 65% of child deprivation cases involve abusing drugs. And this is disturbing. 30 to 35% of seized meth labs had children living there. And remember, when you're thinking about all these children, how the cycle goes with meth use. They binge for days, they're high. During that time, they don't eat, they don't sleep, they exhibit violent behavior, they're agitated, they have an increased sex drive, and they become intensely self-centered. And then when they stop using, they have the crash phase where oftentimes they're psychotic. They sleep for a couple of days. You're unable to wake them up. So you can imagine if you have children in that setting that they would definitely be neglected or mistreated. There's also an increased amount of meth babies being born. So whatever problems that meth causes in an adult will certainly cause on an unborn fetus. They have long-term studies now that show that there's a lot of retardation in growth, development, language. They have aggression problems. When they're born, they exhibit signs of withdrawal like fussiness, inability to suck or swallow, poor appetite. So what's different about meth recovery? One of the main things is there's no detox drugs. There's no true rehab. They have no physical withdrawal, but rather a feeling of anhedonia and ability to inexperience pleasure. This feeling can last for months up to years as a result of these damage to the dopamine receptors. And this is usually when they relapse because they feel so helpless and hopeless and they're so depressed and they can't get excited or feel happy about anything. And during this time, they are very prone to relapse. Studies show that long-term sobriety occurs in less than 10% of meth users. Other studies show that the relapse rate is 92%. The treatment of choice is behavior therapy, something that's kind of like a 12-step program. They really stress to stay away from triggers. This is activities, people, places, anything that reminds them of their meth use. They specifically warn against the use of alcohol because that lowers their inhibitions and makes them more susceptible to these cravings. As a healthcare provider, our main role is in identification and education. We must educate our patients and communities about the dangers of meth, how quickly people become addicted, and they especially need to be aware of potential long-term permanent damage to their body. We need to be familiar with the resources that can help them with their addiction. In Dalton, Georgia, there's a Highland Rivers Drug and Alcohol Treatment Center, a Westcott Mental Health Center, and something people a lot of times aren't aware of, there are several local churches that have support groups and counseling available free of charge. This provides them with a loving environment that they can have support, not just through their 2 weeks of rehab, but for the rest of their life if they choose to stay there. They can build relationships there, something that they may have been lacking. Meth use hurts not only the user, but everyone around them. Children are the most vulnerable. There's no single agency that can protect them. They're hard to identify, and it's just a lot of barriers to really getting them the help that they need. The responsibility goes out to every adult who comes in contact with a child who they suspect may be neglected or being raised by people with drug problems. As nurses, we are in a unique position to identify and look at clues. For children we take care of, their parents who may have children, and we are responsible for educating them, and also if we think that they are endangered, by alerting the Family and Children's Services. Hopefully, by raising awareness of the dangers of methamphetamines, we can come together as a community to help the user and especially help the children emerge from the shadow of their addicted parents.